So question 3, I think you've answered this one already. Do you do a corneal or scleral incision? And you're saying you've moved from a scleral incision, where you'd have to open up the conjunctiva and do a scleral tunnel. Now you're doing more a corneal incision.
Yes. I would be interested to know your thoughts about this as well. I certainly with the scleral incision, how shall I put it? I mean, certainly it's a more conservative approach. It's more involved and includes making a peritomy and doing some cautery, probably closing the conjunctiva in some way. And I think that you're still making that same size incision. You're probably having more astigmatic effect by doing it in the cornea. And I just wonder, for example, how much astigmatism we cause by making a 4.5 millimeter incision versus a 2.75 cataract wound or what have you. I mean, I know it's different. In my own patients, I haven't measured it per se. And again, it kind of goes back to the issue of, what's the visual function of the patient? What are their visual needs? What are their refractive expectations? So I don't consider it, and this may be a little bit sort of, sticking my head in the sand, but I don't consider it really a main driver, that marginal increase in astigmatism that one causes by making a corneal versus a scleral incision of that size. I don't consider that to be a main driver, and certainly it is a lot more convenient to make the corneal incision. So what are your thoughts on that?
I've always done a corneal incision, and certainly if I'm doing combined procedure like a clear corneal phoco, I'll go through the same wound to put the graft in. But with the clear corneal incision, I do make it a bit shorter than I would say for a phoco. And as you know, when you're putting the endothelial graft in, you don't necessarily want it overlapping the corneal incision. So that's why I tend, even my paracenteses, I will make them a little bit shallower, bit shorter passage to make them more peripheral in the cornea than say my normal paracentesis.
Yeah, sure. I mean, those are great points. I think that the one thing you don't want to have to do is through the paracentesis incisions is manipulate the graft, and you have a hard time kind of getting under it.
If you enjoyed this lecture so far, please subscribe to http://iop.vision. I hope you enjoyed this series as much as we have putting it together. Thank you.